Another area where the President and I have differed is on the issue of health care. Very tumultuous vote, very tumultuous topic, really, for the entire country. And I want to give you some reasons why I voted against the health care bill, because I know people have very valid concerns about the issue of health care. We're all worried about whether or not our health care system can be sustained in its current manner, where health care costs continue to rise, insurance premiums continue to rise, doctors continue to be concerned about their malpractice claims. But this bill that the President put on the table had basically two huge components. About a half a trillion, I gotta get these numbers right. You know, every time you step out of Washington, the numbers look unrealistic. $500 billion of additional taxes, fees, and costs that are gonna be imposed on an economy that is already struggling. Money that the federal government is going to reach out of the economy and take, that employers would be using in order to create jobs and put people back to work. And $500 billion of cuts to Medicare. And the one thing that we all know is that Medicare is a program that is headed toward insolvency. And it's just basic math. You cannot take money out of a program that is headed toward insolvency and make it more solvent. Those are cuts that I'm very concerned about. It's going to go right to the issue of how we provide care to seniors. This is a program that was not able to sustain those cuts. It's not as if they had an extra $500 billion lying around. One of the most troubling cuts is about $140 billion that's going to be cut out of Medicare Advantage. How many people in the room have Medicare Advantage? Well, I'm very concerned as to whether or not that program is going to be able to be sustained with $140 billion being taken out of the program. Just now, the carriers that you rely on are beginning to evaluate what those cuts will look like, how they'll be implemented, and what coverage and how that will go directly to the issue of the care that people receive under Medicare.